Our relationship with Leyland particularly has been ongoing for some time, and I guess that has built a relationship so that we are part of the school, we're not separate to the school. The school has always welcomed us, so we will attend school functions, for example, so that the students get comfortable with us being around, so that the students know that we are safe people to be around and to be honest with.
In our school, we make a concise effort to be aware of all of the services that are available in our community, so we can be recommending and have a great knowledge of what we're recommending to parents and introducing them to various agencies as the need might arise. So, we might have, childcare relationships with childcare organisations, relationships with medical professionals, relationships with psychological people and things like that.
One of the parts of work that KidsMatter encourages schools to do is to look at who's in the community. Who are the people that we relate to? Who are the people that families are in touch with? And in all communities, there are health and community professionals who might be working in private practice, they might be part of an agency, they might be part of a government department, and even in schools there will be some health and community staff.
One of the beauties of working in, if you like, a community setting as a school is that as a clinician I can be quite aware of what's happening around a child, and a lot of what I do is an advice role, if you like, to teaching staff but also to parents, how to go about assisting a child to deal with the transition that they might be dealing with, be it a family transition or a death or some other situation that the child's confronted.
And that means that when schools are looking at the mental health and wellbeing initiatives, when they're looking at children who might be experiencing some difficulties, they're able to partner with those people and they're able to then work together to really look at what it is at the school that we can do, what is it that the health and community professionals might be able to do some work with families around.
As we got to know our families better, we learnt that a number of agencies were working with some of our families in the community. And we hadn't been aware of that, and we made it our business to make connections and to establish relationships with those agencies.
And KidsMatter really encourages school staff to recognise early on when there's a concern, and knowing what's out there in terms of support in the community can mean that the school can work closely with the family to get that help quite early. And in that way it can feel like there's a linking point, it can feel like schools are not alone in this work, and families can feel that like they're getting the support that they need.
We like to also think about how we can contribute to those agencies in their work and their mission, because we know that if we're able in some small way to contribute to a stronger, broader community, well then our children, our families will be a part of that stronger community and the outcomes for our children will be better.